Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. We're going to be moving forward on the top 200 drugs. We're up to drugs 10 through 15 here. And with that said, this is really meant to be kind of a broad, quick overview to kind of help you guys prepare, plan for board exams, things of that nature. With that said, I've got over 300 episodes now at reallifepharmacology.com. If there's more information, deeper information you want about, pharmacokinetics and drug interactions and things of that nature, go check out reallifepharmacology.com. Again, covered over 300 medications now, some of the most commonly used drugs. 10 to 15 minutes of content on each individual drug, and now just kind of giving you some highlights for those of you that may need a little bit of quicker help on the top 200 drugs. So again, highlighting those things that frequently come up in board exams that I've seen throughout my career in pharmacology classes, board exams, and then things I've seen in clinical practice as well. So with that said, without further ado, the number 11 through 15 is the numbers that we're looking at here. The first one I wanted to mention was Metformin. Brand name of this medication is glucophage, and this medication is used for diabetes, and it reduces hepatic glucose production. That's essentially how it lowers blood sugars, and obviously helps reduce A1Cs and get patients to goal there. Primary use is going to be diabetes. There's a few other off-label uses I have seen, like PCOS, for example. But by and large, it's going to be used for diabetes. Historically, this was a first-line medication for diabetes. It has slightly fallen out of favor due to some of the newer agents that have cardiovascular risk reduction, such as SGLT2 inhibitors, GLP-1 agonists. But metformin definitely is, one of the top 3 or 4 classes of diabetes medications that you're going to see used. Adverse effect profile. So GI is the most common adverse effect you're going to run into. So we're talking about nausea, vomiting, and diarrhea. And I would say diarrhea is probably the most commonly reported adverse effect that I've seen in my practice. So with that, we do have some ways, to kind of get around it or potentially minimize that risk for those GI adverse effects. So the extended release formulation and appropriate titration is something that I think is really, really important that, sometimes gets missed. Sometimes providers want to be aggressive with the dosing. They want to get that A1C, those blood sugars down quickly. And occasionally I have seen an overly aggressive initial dose or titration, which I think increases those risks for some of those adverse effects. A couple other things to think about with the adverse effect profile: lactic acidosis. That risk goes up as kidney function goes down. So that's one thing to think about, and metformin is contraindicated in patients with lower renal functions, less than 30 mils per minute, for example, there. B12 deficiency is another thing I've seen come up in practice. So, metformin, you're likely to be on it chronically. It can definitely cause some B12 deficiency, so pay attention to that for sure. And then I alluded to it with the risk of lactic acidosis, but we really got to monitor renal function. If that dips too far, we're likely going to have to at a minimum, reduce the dose of metformin and possibly discontinue it, depending upon how low that renal function goes. All right, next medication is Atorvastatin. Brand name is Lipitor. This is a medication used to lower cholesterol with primary focus on LDL. The dosing of this medication, remember we've got low, moderate, and high-intensity statin medications for cholesterol. Atorvastatin and rosuvastatin are the two that reach kind of that high-intensity status. Dosing of that atorvastatin for high-intensity purposes is in the 40 to 80 milligram range. Mechanistically, it inhibits HMG-CoA reductase, which is the rate-limiting step in cholesterol biosynthesis. So that's ultimately how it reduces LDL. There are some potential, obviously, adverse effects. Myopathy is probably the one that you're going to be most highly tested on, so muscle pain, soreness, achiness, which ultimately could lead to rhabdomyolysis. From a drug interaction standpoint, there are some with atorvastatin. I wouldn't maybe call it severe interactions, but there is some potential where CYP3A4 inhibitors, CYP3A4 inducers can alter those concentrations. Inhibitors would increase concentrations. Inducers would reduce concentrations. And again, if you want more details on that and some of the highlights for drug interactions, go back, find the Atorvastatin podcast, and definitely take a listen. We'll do a deeper dive there. All right, next medication, Omeprazole. Brand name is Prilosec. This medication is found over the counter, most frequently used for heartburn, GERD type symptoms. It being a PPI, it's a proton pump inhibitor, so it's going to reduce the amount of hydrogen ions, which essentially leads to higher acidity in the stomach. So by reducing those hydrogen ions, you're going to create a less acidic environment and obviously, hopefully, less symptoms of heartburn and GERD and things of that nature where the stomach acid and stomach contents are coming up into the esophagus there. From a short-term perspective, PPIs generally don't cause too many problems with adverse effects. In a longer-term aspect, we can contribute to C. diff risk, potentially osteoporosis, pneumonia. Also deficiencies like B12 and magnesium have been reported as well. So those are definitely some things to look out for in practice for sure in patients taking long-term PPIs like Omeprazole. And then drug interactions, probably the two I wanted to highlight the most. Citalopram concentrations can certainly go up. That's kind of a common one, and increase the risk for QTc prolongation. And then clopidogrel. That's kind of a controversial one, but there is at least theoretical potential that it could inhibit the action of clopidogrel. Moving on, we've got an antibiotic for infection. We've got Ciprofloxacin, and brand name of this medication is Cipro. And this primarily covers gram-negative organisms, and in practice, I've seen it most commonly used for the treatment of urinary tract infections. These, when I first graduated, it was probably over 10 years ago, quinolone antibiotics were frequently used. Ciprofloxacin, levofloxacin, but now we've found that there's plenty of potential long-term and or short-term complications. Can increase the risk for tendonitis, tendon rupture. There can be some central nervous system changes as well, and these are all boxed warnings with ciprofloxacin. So definitely plenty to pay attention to there with this medication when we're using it for antibiotic purposes. With drug interactions and Cipro, I did want to mention binding interactions. So co-administration with calcium, with magnesium, iron, that's going to bind up oral ciprofloxacin and increase the risk for treatment failure where we don't get enough absorption, we're not getting enough into systemic circulation, and we can't treat the infection that we're trying to treat there. We've got Zofran. Last but not least, we've got Zofran. Generic name here is Ondansetron. It is classified as an antiemetic medication. Adverse effect profile, generally not too significant. I guess I've probably seen, CNS changes, most commonly, maybe a little bit of dizziness or something reported. It does have some serotonergic type activity, so that is something to pay attention to if we've got a patient on a bunch of other serotonergic type medications. Ondansetron is one of those where I definitely think about the prescribing cascade. So if I see an order for an as-needed Ondansetron, I likely know that it's going to be used for nausea and vomiting type symptoms. As a pharmacist, I definitely want to go back and look at that medication regimen and make sure that we're not causing the adverse effect of nausea and vomiting from another medication we've added. So, and I mentioned maybe one of those, Metformin's a classic example that can cause some nausea, some potential GI upset. So you want to go back whenever you see, or whenever maybe you're thinking about writing an order for Ondansetron for a patient with nausea. We've got to make sure that we're not causing some drug-induced toxicity there, which is causing the nausea. So I've seen a lot of seizure medications when they're at toxic levels. Lithium's another great example. Digoxin, that can cause some GI problems as well if it's at toxic levels. So again, go back, look at that, make sure we're not causing or contributing to the prescribing cascade. All right, well, I think that's going to wrap up the podcast for today. Do me a huge favor. Go to reallifepharmacology.com, subscribe, get your free PDF on the top 200 medications. It's an absolute no-brainer, simply an email. That's all it's going to cost you. Also, support our sponsor, meded101.com/store. We've got great board exam prep material, all listed there at meded101.com/store. All your purchases there go directly to support this podcast and obviously help pay for it. So greatly appreciate any support there. Purchases, books, study materials, and things of that nature. Do us a favor, leave us a rating, review on iTunes or wherever you're listening. Greatly appreciate that. Any comments, reviews, I've certainly been appreciative and certainly humbled by a lot of your kind words. I greatly appreciate that. If you've got comments, suggestions, feedback, don't hesitate to reach out to me, Eric Christensen, PharmD, BCPS, BCGP on LinkedIn, or you can track me down at mededucation101@gmail.com. Thank you so much for listening, and I hope you have a great rest of your day.